One.
Hello, everybody, and welcome. This was going to be streamed on YouTube, but YouTube said, blah, blah, blah. And then we tried Facebook, and Facebook said, blah, blah, blah. So we're recording this, so you can't ask questions to us live because we're not live, but we are here. And if you have questions, please send them into Buchanan. They'll forward them to me or to Lyra here. So let's dig into this round 3 or 4. Hi, my name is Paul Wallace. I'm a certified personal trainer, CCEP CPT, and an ASMCES corrective exercise specialist. And I work at the Buchanan Center in Edmonton with Parkinson's clients. And I'm here today to do a big discussion about some new technology and pieces and how it relates to Parkinson's or not. But I'm not alone. I'm not alone. I'm here to my visual left, perhaps to a different side for your screen. But over here, I have Lyra. So Lyra, who are you?
Thank you, Paul. So hello, everyone. My name is Lyra, and I am a second-year practicum student from NATE with a course personal fitness trainer program. And I'm here to join Paul today in our talk about a very interesting topic.
It's true. It is very interesting. So when I first came to Buchanan, I came through the NATE program as a practicum student as well. And then I've been there now for a number of years working. So every year we take on a practicum student. And right now it's Lyra. Maybe down there, maybe over there. But Tamisha's over there on the Zoom screen. So what we're going to talk about is this. What they commonly call massage guns. This piece bumps back and forth and there's different ends for it. So massage guns, which you can target individual muscles, individual parts and pieces. And some of the benefits to them for general population. They've come out really, their big thing right now in the fitness world. Everyone in the fitness world is using these things. Oh, for warm up, for cool down. Oh, for DOMs, for sore muscles. Oh, there's just it's the best thing. It's better than anything ever before. But we all know from marketing, we know from YouTube and TV and Facebook that marketing is marketing. It's going to push, it's going to say, this is the best thing. This is the thing you have to have. These things are so popular. You can find them in London Drugs. You can find them online for $700. You can find them at the store for $110. So we're going to go through what these are, what they do, pros and cons, and also how they relate to Parkinson's clients and how there can be perhaps some work these things can do extra for your population. So we're going to discuss that today. We have a whole PowerPoint set aside. We're all ready to go. Lyra, anything you want to add to that?
Sounds pretty good. Complete information for the introduction.
Okay, well, introduction. Let's just go. I'm going to share my screen now over here to this guy. And here we are. Okay, Motivation Monday. So welcome to What the Heck is a Massage Gun and Do I Need One? So here's the question. So as I said, with marketing, things come out that are new and everyone goes, oh, this is the greatest thing ever. This is so amazing. This is super. I said, that gun that I showed, that's mine. I use it every day. It's fantastic. I love it. But does it make everything better? Is it the golden egg, as it were? So we're going to discuss that. We're going to kick into this piece here. Next page, if there's screens. Okay. So massage gun is a bit of a misnomer as far as the name is concerned. It really is a percussion gun. So these are two of the most popular models. The silver one to the right of my screen is the Hypervolt. That's what I have a cheap knockoff based off the Hypervolt design. And then the other side is the Theragun. You may have seen ads for these on the internet or in newspapers. So the Theragun runs $300 to $700. It is cool because it has a handle. You can grab different sides. And it does have the most travel as far as how far it oscillates back and forth. The Hypervolt is very popular, being smaller and lighter amongst runners. I have several track athletes that I know that use the Hypervolt themselves. So really it's less of a massage gun and more of a percussion gun because of how it works. So that tip goes in and out, forward and back at a high speed. Actually, I'm going to stop the share for a second and just show exactly what that looks like. So if I turn my gun on, push the button on the back, so you can see the front of it there in front of my face. Now it's going back and forth, in and out, traveling, and then you can see my muscles sort of shaking here as this moves. So this is what it is. So massage is somewhere where it's going to take their thumb in, they're going to push, and they're going to massage the muscle. They're going to push along the muscle. This is percussing. This is going in and out and pushing. So you move it. I don't push in. It's doing all the work itself. Pushing in. You can really only use these over a soft tissue. If you end up going over top of a bone or anything, it stutters like this, and that hurts. It's bouncing off the bone itself. It's just a soft tissue kind of piece. So that's what it looks like. That's what the gun sort of is. Now we'll dig into what that actually does. Okay, so Hypervolt Theragun. Kick on over. Oh, I missed a page. There we are. Pros. Okay. Advantage of this thing is they're portable. You know, you can take it with you. You can have it charged up. And most of them come with their own carrying case. So you're heading on vacation, or it's not wired in. You don't have to plug it into a wall and then sit in a chair by the plug-in and try and massage yourself. Because it's battery powered, you can charge it. You can take it and have it sitting on your bedside table. If you wake up in the morning and if your leg is sore, you can massage your leg right there. Easy to use. It's not really that complex. Once you know where the muscles are, usually you can tell by what's sore. You can push on it. You can see it's customizable as far as the speeds. Most models have between 3 to 5 speeds. Mine's a 3-speed model. I barely ever use the highest speed. I use level 1 and level 2. Some of the big ones can go up to 10 levels, and some of the cheap ones go down to like 1.
Mhm.
So there are also different tips you can see on the screen here. We have a slide later that digs into the tips of digs into the tips. That was funny. A little more detail on the tips and where the different tips are used for different parts of the body. They are readily available at retail outlets. Like I said, London Drugs, Shoppers Drug Mart, online, Amazon is full of them. And there's probably 4 or 5 individual retailers across Canada, most popular being Bang out in Toronto, that sell these devices. And most of the ones that aren't a Theragun or Hypervolt are knockoffs made in China, Vietnam, Taiwan. Does the same job in my opinion. I'm totally fine with mine. Mine was like 120, and they're not overly expensive, like $100 to $200 for a basic model. And to some people, $200 might be like, ugh! And some people, $200 is like, that's a tool that I could use, and that's fine. And that's kind of all I have to say about the pros as far as the device itself. As far as what the device does, we'll get into that. So Lyra, your turn.
All right, so we have some cons as well using this product or with this product. So percussion guns are battery powered. So eventually the battery will die. And there's also a weight to it, probably 2 pounds or less total equipment when you're holding it. So it kind of, there's really a heft to it. And the base or shape can be difficult to maneuver. So there are like different types of handles, as what Paul showed earlier in the picture. So sometimes if you're not properly holding it, it could cause you like a strain on your wrist or whatever, since the shapes are like difficult to maneuver, like for some, and there's also weight to that. So, and also it is mass produced, so it's cheap. That means the overbuild quality can suffer. And then some models only have like an on and off switch, and that's only the options that you have to turn on and off. So that's probably some of the cons that we know of like now with this product. So yep.
And that's not uncommon. If you have something that's mass produced, it's the flavor of the week as far as marketing is concerned. You're going to have things that are made cheaper that do sort of the same job.
Yep.
And that's just how it works. That's
Mm-hmm.
called marketing. That's called capitalism. So this is my slide. Okay, so foam rolling SMR versus a percussive gun. So SMR is self-myofascial release. It's foam rolling for the common vernacular. So you see the nice young fit gentleman in the blue there. He's getting to a fairly common but somewhat extended position. As it says, it requires balance, strength, a level of body coordination. If you have a sore leg or a sore back or whatnot, and perhaps you're of an older age, and perhaps the getting down onto the floor and using a foam roller may be something more challenging than your body will let you do, even with some assistance. Foam rolling, while it has its benefits, may not be the most beneficial thing for you. In that case, a percussive gun, as the other image shows with the young lady with the very strong legs, she has her left leg in a tight position. It's holding her balance and her hand is down on the ground behind her. So all her weight's been shifted to the left side of her body. So her right leg is relaxed. And you can sit on the floor, you can sit in a chair, even lie in bed. As long as the part that you're trying to massage, that muscle is in a relaxed state, you can run the massage gun or the percussive gun along that surface with the different tips and work on that muscle with that structure. So as far as being able to access different muscles in different areas, the percussive gun could have some benefits as far as flexibility and a different level of Parkinson's clients. Is it overall better and we'll do the same thing as foam rolling? No.
Mhm.
If you can get down on the ground and you can do foam rolling, you will see a far more benefit. Foam rolling can access trigger points with a lacrosse ball or a trigger point ball. Foam rolling will roll across the entire muscle. Foam rolling will do a far bigger, more all-inclusive job. But if you're trying to access a really tight calf muscle, do you need to get down on the ground and roll your whole body out? Perhaps not. Perhaps getting access to that calf muscle with a percussive gun may be the most beneficial to you at that point in time. And based on, again, on your mobility, maybe getting access to that calf muscle with a massage gun is the best thing for you. So different tips that come with these guys. Most of them come with 4 to 5 tips on the massage gun. These are like 4 of the most common. So if you look at the first one, the big U shape there, the ridge massage, as I showed you when it bounced off my hand, when it hit like sort of the edge of my hand muscles there, hand bone, pardon me, around the thumb, then it bounces off. So with the rigid massage, it's a hard plastic tip, but you can go down on each side of the spine and it massages both sides. Part of Parkinson's that sort of happens with time is the clients will get bent over forward. The back will start to tighten up around the shoulders and they'll become a little more hunched in their posture. So the muscles that keep us upright on our back, the post upright, are called the erector spinae. And these go basically right up your back, from down near your hips, basically right up your spine, up into your shoulders. So rigid massage is a really good piece to hit with that. Because you can just have somebody, this if you want someone else to help you, you want to lie down or just be sitting in a chair in a relaxed posture, just arms at your sides or arms on your lap, and have somebody run this down your back. I do this for my wife every day. She loves it. The rigid massage will go right down each side of your spine, with the spine going in the middle of the U shape and give you a really great massage up and down. And as I said before, you don't push. The gun goes in back and forth, oscillates back and forth in a movement with a travel of 12 to 16 millimeters, depending on the quality of the gun. And you can get a really good massage, well, really good muscular relaxation effect, I guess, not a massage, using that piece. The second piece is the round massage head. That's not a plastic tip, that's a sort of a foam tip. As it says, good for large muscle parts, because this is, from some knockoff device. So large muscle groups, if you want to do your legs, the front of your legs, the back of your legs. If I'm going around my calves and my quads and the top of the thigh, hamstrings, back of my thigh, and even into my glutes and my bum, I'll use the round massage head just to give the legs a brush over there, do some blood flow increase. The bullet massage, I can use that guy mostly if I want my calves. Because I cycle and run, my calves can get quite tight, especially after workouts or the day after if I didn't stretch out well enough. And the bullet massage can dig right into a certain point and push through. With these guns, you want to keep them moving. These are not a sit in one spot and push down on it, like a Charlie horse or a tight muscle. You move back and forth across the muscle. You'll get some vibration deep into the muscle, but mostly these are a surface device. And the last one, the flat massage head. I use that one almost identical to when I use the round massage head. I found the round massage head can get caught on clothing. If I'm wearing pants instead of shorts, trying to do my legs, I'll use the flat massage head. It'll slide better because it's just plastic. But I use it almost interchangeable with the round massage head for myself on mine. Oh, the important one. Larry, okay if I take this one?
Yep.
Okay.
Get it.
Big red text disclaimer. We're not providing medical advice, guys. That's outside our scope of practice. As certified personal trainers, we have 2+ years of post-secondary plus other knowledge that we've taken through the NATE program. We're recognized Canada-wide as the gold standard. We have the highest level of training certification you can get in the country. But we're not doctors. We're not physical therapists, not occupational therapists. We're certainly not neurologists. We're not GPs. So we've reviewed, between the two of us, over 15 research papers, with a good hefty chunk of those relating directly to Parkinson's on these devices.
Mhm.
These are actual research studies. These aren't off BuzzFeed. These are actual, medically challenged research studies. So what we're giving you is our opinion based off what we've read. We're relaying the information that we've discovered, translating it down to general population language and presenting it to you guys. So it's our opinion only based on the stuff that we reviewed. So if you are someone who is perhaps more compromised, or you're, well, it's 100 $150, I can spend that. I'll get one and see if I like it. That's your choice. Or if I'm not sure if this would help me at all, I better talk to my doctor. Then absolutely we recommend that. Discuss with your physician neurologist before you buy a gun if you're not sure. Because they may say, nah, it's not for you. Or they may say, yes, do it. Or they may say, give it a try. Let's find out. Because coming into vibration therapy has been used in Parkinson's before, but that's full body stuff that Lyra's going to talk about. Vibration therapy in a massage gun or a percussive gun is something that's very new to Parkinson's in the research aspect. So we have some information, but we don't have a lot of long-term information yet. Because again, these are the latest thing, the newest flash in marketing.
Mhm.
So, Lyra's favorite page. Take it away.
All right, so we're going to talk about how this percussion gun pertains to Parkinson's. Okay, so we, like what Paul said, we have been digging into research papers like previous this month, and we've been, seeing some helpful ones that we can share to you guys. So I have a couple here that I can take it out. So this is a study that was published by Neurorehabilitation. And it was about the percussion therapy. So it says like there's two types of percussion therapy. It's like the whole body percussion therapy and the localized percussion therapy, which we're talking about is the percussion gun, where we localize a specific area of our body to do that therapy at. So this can help with people with Parkinson's disease by decreasing the muscle tremors. That's what the study says. And the researchers in their study, they used this physio-acoustic chair. So this is basically the whole body percussion therapy that they tried, but it's still the percussion or the vibration therapy, which the percussion gun offers. So it is an equipment with speakers spaced throughout the chair, permitting a series of frequent sound waves through the body. So they prepared a set of Parkinson's disease assessment before starting the experiment, right? So the people that they have in the study are also people with Parkinson's disease. So they prepared a gait or walking assessment and also, fine movement assessments for the fine motor skills. And the results showed significant decrease in rigidity and tremors. And there's also significant increase of step length and increased speed on the pegboard task for the fine motor skills, where we use our fingers and our wrists. So that was a really interesting study because it also talked about like the percussion therapy, but it was just focused on the whole body ones. And we also have this other study, but it was focused on athletes, but it was using the percussion gun as well. So it was published by the Sports Science Med, and it was to see the effects of a 5-minute percussive massage treatment of the calf muscles for checking the dorsiflexion, range of motion, and the plantar flexion muscle torque. So that study was done with adult athletes, and the results from that study showed there was increase in range of motion for the dorsiflexion, and the plantar flexion torque was just the same, which is a good thing, right? So again, Parkinson's disease is a progressive disease, which means it gets worse over time, but usually this happens slowly over many years. And movement or exercise are one of the good treatments that can help you live a full life. And some of the common symptoms and signs of Parkinson's are muscle stiffness, like muscle tension and rigidity, tremors of the arms, legs, and hands, which is really important for us when we're like moving. And most debilitating symptom includes rigidity. That's the number one. And as described to be the resistance of motion. Okay, so that being said, percussion guns does somehow localize percussion therapy. And this kind of therapy, again, sense vibrations throughout the body and causes muscles to contract and relax. And that also means it also should support increase in blood flow to the muscle area, providing pain relief and increased ROM or range of motion, along with a slight stretch to that muscle that you have locally percussed with the percussion gun. And this all being said, it is also still important to remember that warm up and getting up on your feet and get up and start moving is a really still the good warm up for doing the exercise program. And also we must also remember that there are risks using this percussion gun, especially if you are not aware of how to use it. If you have no idea on how to even maneuver it, there could be risks as well. So almost like you should also get informed. That's why before using it, ask someone or your healthcare provider as well, and to help you and guide you so that it could see you could get the benefits of it. Well, so that is all for the research studies that I have seen and Paul has also seen. And if there's anything else that Paul could add or talk about it, you can go shoot it up.
I'm going to kick off here. I want to turn the share off real quick. I want to just show you guys some pieces here. So when Lyra is talking, because in school we get all sciencey. So when Lyra's talking about the calf and that stretch, talking about dorsiflexion and plantar flexion. So if I'm in my foot here, plantar flexion is when you're talking about the calf being massaged by the gun. Plantar flexion is pointing. So that is the role of this muscle, is to push that down. And when you go up on your tippy toes, you are using the calf. Dorsiflexion is a little more difficult. The little muscle up here called the anterior tibialis, or the tibant, I call it, that's pulling your toe up. And it has to pull here, and this part has to stretch to allow that. So the research had, when this leg was relaxed, and they did test it, how far somebody could point, how far somebody could pull those toes up towards the knee, and then they massaged this, moving around for 5 minutes through the gastroc and the soleus down here. They then had an increase in the range of motion. They could push farther and they could lift farther. And that really ties us into the Parkinson's aspect as far as an increase in flexibility from a massage gun treatment, which we find to be very interesting. Very, very interesting. I just want to dig into that piece. Let me go back over here to the slides, share screen. And the very last piece, she says, like, it doesn't replace a warm-up. If you're going to go for a walk with somebody and you have a tight calf, and you normally have a warm-up you do, tip some toes and leg swings, whatever it might be, I would not grab a massage gun, massage your leg and be like, I'm good to go, and then walk out the door. You could use a massage gun and then do your regular warm-up, and it would aid in that. So say this does not replace a warm-up. This does not replace any other work you may do. This may be a good additional piece of equipment to help you as a full part of your toolkit. Let's go to the next slide. And here's the main piece. Like, we think there's some positive points to consider. I don't think there's any real need to own one at this point, unless your doctor recommends or you feel that you want to try it out and go for it. If it's prescribed by your physician neuro, make sure they show you exactly how to use it. Lyra and I, going through school, we know where all the muscles are. We know what the muscles do, how they move. We know all these pieces because you learned them. It's specialized information. Unless you have a medical background or you dig really deep beyond YouTube, you may not know where all the muscle pieces are. So you want to make sure you're hitting everything that pertains to the movement you're trying to increase. Again, if I'm trying to point my toes, I need to know where to massage to make that happen. So if your neuro says, yeah, go ahead and give that a shot, or a physician's like, yeah, it couldn't hurt, I don't see a downside to that, party on. Absolutely. If you want advice on massage guns, talk to Buchanan Center. They'll forward your question to me, and I can provide you with some links and information, something you want to look at. And then note at the bottom, like, I use mine all the time, and I love it. I absolutely love my massage gun. I bought it for myself for Christmas birthday present. My birthday's in December, and it's fantastic. I bought it to try it out for myself, and because I work with Parkinson's clients, I was curious about this information. how it would feel. And I love this thing. It's great. But as it says too, it's not the ultimate solution. I still foam roll. I still stretch. I still warm up. I just also use a massage gun because with running and cycling, my calves get very, very tight. So I use it mostly on my calves and a bit on my back is the main parts I hit. Everything else I tend to stretch out and foam roll. So it hasn't replaced anything, but it has supplemented, and I have felt benefits. I do feel like it accesses things in a way that foam rolling doesn't quite hit for me in a much shorter time frame because my time is occupied because I have children in school and a dog and life and work and all the pieces. So I think, is that our last slide? That's our last slide.
That is our last slide.
Okay, I'm going to turn the slide off. Come back over here. So there, that's the basis of what we wanted to discuss today. The NAEP program really pushes the science of things, and it's that our certifications are very sciencey. So this is a percussion gun. This part oscillates in and out, as you can see. Right here, it's the sound of it slapping my palm with my arm. If you do it, you move it like this, depending on which tip you're using. It's not a thing. You don't push on it. You just let it go on. Wakes things up. Bit of an increase in blood flow, the research has shown as well. But if you haven't heard of these things, that's not surprising. Maybe it's just not in the circles that you travel in. If you have heard of them, I hope this is a little more information for you. 1, 2, 3. You can probably hear the difference in the speed there. This is by far, oh, that's almost painful. Yeah, it's almost a painful thing. It's 2. I use level 1, level 2. Fantastic little device. This is a knockoff of the Hypervolt that I got off Amazon. And I love it. And the thing to be aware of too, so that's all the battery. That's where most of the weight is in the handle. This part's very, very light. The motor itself. All the weight's in the battery pack. So when we were discussing some of the access as far as trying to use it, if you're trying to massage your own back, you gotta hold it like this into the handle. And now you're maneuvering 2.5 to 3 pounds around your body. So in some parts, maybe having a care partner or someone else help you out do it. My wife just sits there and I go behind her and I massage her back in a way, because if I try to massage my right shoulder and I'm using this, my whole shoulder is tight because I'm supporting it with this hand. I can't access it. So some parts may be good to have a care partner if this is a route you'd like to look at. So talk to your physician, talk to your neuro, ask them about a massage gun and some of the pieces, and there's some research on it. If you want links to the research that we found, you can Google it. But we can also totally provide links to Buchanan Center at the Parkinson's Alberta to share out. If you guys want to read some research studies like we did on these things. I'm not sure there's anything else we need to say. What do you think, Larry? I think we've covered it. Everything we wanted to say, I think we've covered. What kind of questions do you think people would ask?
I wonder that as well.
We answered those. If it's really no good, why are you bothering telling us? I'm a believer in information. I think the more information you have, the better. If somebody says something, this may or may not be good, then the decision is yours of where to go forward with that. Better than someone coming in saying, I looked at these, I don't like it. It probably wouldn't work for you. That's nonsense. We don't know. Like it's up to you and your care team of how it may help you. Buchanan and Parkinson's is a huge part of my professional training life. I love the people that I work with. They are just amazing. And the people at Buchanan Center and Parkinson's Alberta are amazing. I do this for the heart. I do this for my heart. So if I can provide information that may be a benefit to the population, a benefit to you who are watching this, if you have Parkinson's, then I feel that's the least I can do is provide that information. If I don't tell you and you don't know, maybe you're missing a piece of your care plan which could be beneficial to you. And that would be wrong. If there's something that I know, I'm going to share it and hope it can be helpful. That's what inspired me to do this talk today. I'd like to really, really thank Lyra for doing a whole bunch of, she's over there for me. Maybe she's there for you. She's over there for you. I really want to thank Lyra for putting a bunch of work into this as well as a practicum student while she's going to school and working. She's here right now on a Monday morning for us. So thank you very much, Lyra, for being here.
Thank you also,
Goodness.
Paul. You're the best.
Thank you, Alicia, as well, for running the Parkinson's side of the technology for us.
Yep.
Thanks.
To make this all live. So if you do have any questions, I don't want to put my email address on this, but you probably have contacted Parkinson's Association, either your local chapter, if you're anywhere in Canada. You can talk to your local branch about percussive massage guns, or if you want to contact me, you can talk to the Buchanan Center, Parkinson's Association of Alberta, and like Declan or Ashley, who you want to speak to. You can call the main desk and get them, and they can pass you over to me.
Sure. And even we have info@parkinsonassociation.ca.
Perfect, even better. And then whoever has access to that, so that goes to the front desk through Decola or somebody, they can send it to me as well. They all have my email address. They all have my cell phone number. So they can pass you over to me and we can have a conversation about this. I'm more than willing to use my time. I am working less because of COVID, so I am home. I have my cell phone, I'm available. So if you have questions about these pieces, I'm not going to give you medical advice, but if you have a question about something, I'm more than happy to answer it to the best of my ability. If I don't know, I will tell you that I don't know. But if I do know, brace yourself, because I'm going to tell you. And I think that's anything. Lyra, anything you want to add to that? Have I wrapped it up okay?
Yep. I wish everyone have a good week.
Yeah.
Thank you.
Cool. Alicia, anything on your end we need to do? Any housekeeping?
No, we're good. Thanks so much. Have a good
We're
day
good?
and a good week.
Awesome. Okay, well, thank you everybody for tuning in for not a workout, but a workout for your mind, which is just as important as working out for the body. I did want to put a plug in here for the classes that I teach. On Tuesday and Thursdays, I teach a circuit class for people that are a little less affected, more capable, strong, still moving, earlier diagnosis, first 3 to 5 years for the most part. I also teach a class just after that, PD and exercise. I call it PDEX, where I bring people that some people are in a chair and have trouble getting up. Some people have full motion and they're just at that one level down from circuit where their cardiovascular is not quite as strong as it was before. And then I also teach a class on Friday. It's called Fantastic Friday, which is for all levels. You can do the whole workout in a chair, or you can get up and move. And I'm going to do everything from fingers to full bodies. It's beautiful. It's not necessarily a workout to make you tired, but it's a workout to make you work. And that's what I do 7 hours a week right now on Zoom. So you can talk to Parkinson's Association, Buchanan Center about that. Declan or Ashley would program those in. And I'd love to see it. We have people from all over Alberta right now. So if you're seeing this and you're somewhere else in Canada and the time works for you, join us. Talk to our local center and see if we can tag you in. It'd be lovely to see new faces. Thank you.
Thanks, Paul.
Awesome.
Thank you. Have
Thank
a great
you.
day.
Okay, bye.